Hi, welcome back to this second video on muscle strength testing. My name is Dr. Chee-Wee and I'm here today to have a chat about some examples of muscle strength testing used in the context of musculoskeletal practice. Without further ado, let's start. As a reminder of today's learning for this video series, by the end of this week, you should be able to critically evaluate the strengths and limitations of different methods for muscle strength testing, or at least have the tools to evaluate such methods when you encounter them. Also, you will be able to apply the principles of muscle testing in a valid and reliable manner to your clinical practice. To continue from where we stopped in the first video, we will now look at instrumented muscle testing. As you can see, there are multiple methods that this can be achieved. The difference between instrumented versus non-instrumented muscle strength testing is the use of equipment. In this video, we will concentrate on three of them: handheld dynamometers, hand grip dynamometers, and isokinetic testing machines. We'll now first talk about dynamometry. Dynamometry, broadly speaking, is the methods through which we can measure muscle strength or power. For more defined measurements, we can hold certain variables constant, like the load to the velocity, and this yields different dimensions of muscle strength, and we can use it more specifically for assessments. Different types of dynamometers are available for use. However, some are more appropriate than others for use within the clinical setting, depending on what you aim to achieve in your assessments. However, for most clinicians, with ease of use and portability, some dynamometers such as the hand grip and handheld dynamometers are more suitable for everyday measurement purposes. For a more in-depth and detailed analysis, for example in specialist clinics, more elaborate instrumentation such as the fixed load cell dynamometers and isokinetic dynamometers are the ones to use. Let's now talk a little bit about handheld dynamometers. Handheld dynamometers are portable devices that is held by the clinician for testing muscle strength. Now, this is done by stabilizing the body region proximal to the joint that is performing the movement. Then, with the dynamometer placed on the distal body region, the patient is asked to contract the muscle and move the distal aspect of the body region. With the clinician's hand holding the dynamometer in a static position, a force is registered on the device. In the picture, you can see the muscle strength of wrist extensors being measured. So, the forearm is fixed by the clinician and the dynamometer is placed on the dorsal aspect of the hand. Despite the simplicity of use for the handheld dynamometer, its clinometrics or properties is interestingly adequate. For example, the convergent validity of the handheld dynamometer is good when compared with isokinetic dynamometry and functional activities used to measure muscle strength. For concurrent validity, the tool is able to discriminate between subpopulations on the construct of interest. The handheld dynamometer can differentiate between healthy individuals and people with stroke or muscle strength. The reliability of the handheld dynamometer can be variable and is dependent on the local procedures used to test muscle strength. For example, all types of reliability is improved if adequate stabilization of the region tested is good. With regards to responsiveness to change, the minimal detectable difference is between 46 to 57.1 newtons of force in the home care setting. The good thing about handheld dynamometers is the availability of normative values that you can use to compare your patient's results with the general population. Similar to the handheld dynamometer, another easy-to-use instrument is the hand grip dynamometer. This equipment is a special type of dynamometer that only measures hand grip. The principles of application is similar to the handheld dynamometer. In terms of its clinometrics, it is very interesting to see that it has been used as a proxy for persons living with various long-term illnesses on whether they will deteriorate. That is, this simple test has a relatively good predictive validity for adverse outcomes for certain patient populations. It is also reassuring that it has a good test-retest reliability. In terms of responsiveness to change, the minimal detectable change is about 2.7 to 5.2 kilograms. Similar to its cousin, it also has a database of normative values for comparison within the healthy population, which is useful. Moving away from the easily portable devices, we'll now have a look at more elaborate equipment, the isokinetic dynamometer. This equipment can usually be found in larger departments or specialist clinics or laboratories for testing patients or athletes. The picture shows the isokinetic machine by the company Biodax. Most isokinetic machines look similar to this machine. It usually contains a platform on which the person being tested is seated, and the body region is then strapped to a moving arm that is measuring the muscle strength. For controlling the machine and recording the data recorded, a computer is used to perform these functions. Other commonly seen brands that manufacture isokinetic machines are Cybex and Kincom. The interesting thing about isokinetic machines is the ability to control the velocity at which the joint moves when measuring the muscle strength. This can yield interesting muscle power characteristics when we start to look at the muscle contraction at different speeds. One criticism about isokinetic machine is its ecological validity in relation to functional activities. Ecological validity means that the methods through which you're testing the construct is equivalent to the real-world conditions. So the argument goes that the actions reproduced by isokinetic machines are not what happens in real-life functional activities, and therefore, in terms of its validity, it is rather decreased. Despite this, the device has excellent reliability, partly due to the high level of control over joint velocities. That was our last example of instrumented muscle testing. When we are thinking about using instrumented muscle testing, there are some considerations to take note of. We need to tailor the specific testing method to what we're trying to achieve through the testing, the patient we're testing on, and the physical setting of the testing itself. If we're out in a community, it will be obvious that it will be difficult to implement isokinetic testing, and we would also question about how it relates to the more functional activities that we are interested in. Another major consideration for instrumented testing is the standardization of the test procedures. Any differences between testing session or between clinicians might affect the results of the tests. Similar to manual muscle testing that we talked about in the first video on muscle strength testing, the standardization of testing procedure is crucial to good reliability, that is, in testing. Some things we need to take note of are the position of the person being tested, the stability of other body regions to prevent compensatory movements, clear instructions being provided to the person being tested, and lastly, motivating verbal feedback to the person to ensure optimal contraction of the muscles. We've now reached the end of this video. One key message that you should take away with you from this video is the importance of standardization of procedures when using any form of dynamometry and muscle testing techniques. This increases the consistency of testing and in turn makes us more confident of the clinical assessments for both diagnosis, reassessment, and treatment planning. Thank you for viewing this video, and I hope you learned something about instrumented dynamometry. Have a good day, and I'll see you in my next video. Bye.